Okay, good morning everyone. I would like to welcome you all for the first technical session of the Allied Health Sciences International Symposium 2014. So the topic of the theme of the session is promoting healthcare education, the role of healthcare professionals. So now I would like to invite Colonel Dr. Makuloluwa to introduce the chairpersons to the audience. Thank you.
Thank you, Samira. Good morning. The distinguished guests, the academic members of the Faculty of Allied Health Sciences and the students. I take the pleasure of introducing the chairperson of this session on the technical session on health education and allied health science, allied aspects, Professor Nandini De Silva. Professor Nandini De Silva is currently the Senior Professor of Family Medicine at the Faculty of Medicine of Kothawala Defence University. She is also the Emeritus Professor of Family Medicine of the University of Kelaniya. She is currently a member of the Council of University of Moratuwa and a UGC nominee on the Board of Management of the Center for Open and Distance Learning. And she has also held the position of Vice Chancellor of the Open University of Sri Lanka and the President, College of General Practitioners of Sri Lanka. To her credit, she has published over 40 research papers, both in local and international journals, and authored several books. She has also served as an examiner for fellowship of the Royal Australian College of General Practitioners and Diploma in Family Medicine in India, and also served on the editorial boards of global organizations. She is the recipient of many awards in recognition of her academic contribution over the years. So I take the pleasure of inviting Professor Nandini De Silva to take the chair and commence the day's proceedings. Thank you.
Thank you, Colonel Dr. Makuloluwa, Dean of the Faculty of Allied Health Sciences. Academic staff of the Faculty of Allied Health Sciences, Dr. A.D.P. Perera, Senior Lecturer in Biochemistry, students of the KDU, ladies and gentlemen, welcome to the first technical session of the Faculty of Allied Health Sciences International Research Conference 2014. The theme of today's session is promoting healthcare education, the role of healthcare professionals. At this session, 5 papers will be presented by allied healthcare professionals from universities and hospitals in different parts of Sri Lanka. Now, I will read out first the 5 papers that will be presented today and the names of the authors, while I will introduce each presenter when the time comes. So the first paper is on knowledge and attitudes on food and drug allergies among hospitalized adult patients in Teaching Hospital Karapitiya by Mr. G.V.A. Pushpakumara and B. Perera. How can we learn? The second one is how can we learn to work together? Perceptions on teaching learning methods of interprofessional education among pre-registration students from different health professions in Sri Lanka by MS A.D.P. Perera, I.M. Karunathilake, A. Olupeliyawa, and M.H. Ishara. Diabetic neuropathy among patients in the diabetic clinic of the Colombo South Teaching Hospital by M.W.N. Nisansala and S.W. Vimalasekara. Awareness associated factors, practices and myths regarding acne among the students of University of Sri Jayawardhanapura by S.D.P.L. Veeravardhana. Healthcare seeking behaviors among students of University of Sri Jayawardhanapura by S.D.P.L. Veeravardhana. And healthcare seeking behaviors among students of the University of Sri Jayawardhanapura by H.M. Manu Varna and H. Vaidyasekara. As we are all aware, keeping to time is extremely important in any conference. So I would like to request the speakers to keep to time. You will be given 10 minutes for your presentation. And when you see the red light, don't get worried. That means that you have finished 8 minutes and you have another 2 minutes to finish your presentation. At 10 minutes, a bell will ring once. And if you go beyond that time, the second bell will ring twice at 12 minutes. And then I will have to stop you. So please try to keep to time. And we will have questions and answers at the end of the session once all the papers have been presented. And we also have a panel of judges comprising Dr. A.D.P. Perera and Colonel Dr. Olupeliyawa, because I presume there is an award at the end of the sessions for the best paper. Okay. So now we will start with we can't start with the first one because there has been some trouble opening the file. So we'll get on to the second one, which is this one, no? How can we learn to work? Yeah. How can we learn to work together? Perceptions on teaching learning methods of interprofessional education amongst pre-registration students from different health professions in Sri Lanka. This will be presented by Ms. A.D.P. Perera. She is a temporary demonstrator in the Department of Basic Sciences in the Faculty of Health Sciences of the KDU, and her research interests are in interprofessional education, web-based learning and applied exercise science. So may I now invite Ms. A.D.P. Perera to make a presentation.
Good morning everyone. My topic is on how can we learn to work together, perceptions of teaching learning methods of interprofessional educations among pre-registration students from different health professions in Sri Lanka. What do you mean by interprofessional education? Actually, interprofessional education is designed to promote teamwork among different health professions and is defined to two or more professions learn with from each other to improve the collaborations and the quality of care. WHO also acknowledged interprofessional education as an important aspect of healthcare in 1972. And it is also noted that there is an increased tendency towards the multi-professional teamwork in healthcare supported by an increasing body of evidence. Interprofessional education in Sri Lanka. As you know, interprofessional education to the Sri Lanka is new because earlier all the health professional institutions, MLS, nursing, radiography and all the other paramedics and medical, all the separate professions learn their separate education, separate institution. There is no any institutions, these all the professions